Do you feel tired all the time? Do you feel body aches and muscle weakness? Do you suffer with short-term memory loss, shortness of breath? All these symptoms could be an indication of you suffering from low iron levels in your body. Hello and welcome to Take Your Medicine. On today's show, we will be dealing with iron deficiency anemia. Iron deficiency anemia usually develops slowly because it may take several months for the body's iron reserves to be used up. As the iron reserves decrease, the bone marrow gradually produces less red blood cells. When the reserves are depleted, the red blood cells are not only fewer in number but also abnormally smaller. Now you may ask yourselves, why is this important? Well, hemoglobin is the iron-containing oxygen transport metalloprotein in the red blood cells. This means it carries oxygen from the lungs to the rest of the body. Now, if we have less or smaller sizes than normal red blood cells, we have a lower ability to carry oxygen throughout the body, which leads to the body's systems not receiving adequate oxygen to perform its tasks. Over time, you may develop the following symptoms: low blood pressure, dizziness, heart palpitations, headache, cold hands and feet, pale or yellow skin, chest pain, anxiety, depression, constant fatigue, and short-term memory loss. When somebody suffers with extreme iron deficiency, they may sometimes crave ice or dirt, salt, sand, or even chalk to eat. This condition is called pica. In practice, 95% of cases I see affect mainly women. This is because women who have irregular excessive menstrual bleeding usually lose a lot of blood and therefore lose hemoglobin. The body can't make enough red blood cells to account for the loss of blood. Therefore, gradually they become anemic. Also, when women become pregnant, they are usually put on maternity vitamin supplements which contain iron. This is to help them manage their iron since they are now producing the blood for themselves and also for the baby. The most common cause of iron deficiency I see in men are largely due to a bleeding ulcer that has not been treated. Bleeding in the stomach or intestines usually lead to a darkened blackish looking stool. This could indicate an ulcer and should be checked up by a doctor immediately. Bleeding ulcers can affect both men and women. So let's say you go to the doctor and have your iron levels and ferritin levels, which is the protein that stores iron, tested. The results then come back as being low. Firstly, if you suffer from excessive bleeding, the doctor would give you medication to stop the bleeding. Then, they would assess, based on your readings, which iron supplement would be best beneficial to you. The most common side effects of iron supplements are nausea, constipation, and changing of the color of the stool from brown to black. Some foods that help to boost iron levels are liver, spinach, and beetroot. If you have any of the symptoms that I spoke about today, please go to your doctor and have your iron tested. Thank you guys again for all your support and encouragement. Please don't forget to smash that like button and please subscribe to the channel. Also, leave your questions in the comment section below and I will get to them as soon as possible. Take care guys. Goodbye.